Hey everyone, Dr. Gabe Ariciu here with another segment and the thyroid pattern. So this is pattern number 4, thyroid-binding globulin. So when it comes to this issue, it's not super common, but still wanted to go over it for you. So when we're talking about it, it's this section right here. So number 4. Really just comes from high estrogen, insulin issues. You probably will see some of the similar symptoms and things with this, like fatigue, depression, that sort of thing. But you're going to see a little bit more from the hormone standpoint, like cycle problems, PMS, maybe people with PCOS, that's polycystic ovarian syndrome, acne, and then excessive like body hair growth. So a lot of them you're familiar with, probably with thyroid, but then maybe some new ones here. So kind of going forward, we need to reduce the estrogen and then help the PCOS symptoms if that's present. So estrogen. Estrogen is one of those ones that, out of the hormones, it's pretty common, especially today. Like estrogen dominance is really, really common. So we got to help decrease that. And that's the liver's job. The liver's job is to detox from estrogen. So you may want to consider talking to your doctor if you happen to be on like hormone replacement therapy. That's probably the most common cause to this pattern. Otherwise, we need to support the clearance of estrogen, and that could be through various nutrients that help with methylation, like B9 or artichoke or rosemary. Artichoke being one of my favorite ones, but some of those will be very, very helpful in reducing estrogen. Additionally, you may want to consider going organic, as pesticides can act like xenoestrogens. And then you want to remove all plastics, especially if you're drinking out of plastic water bottles, switch to glass or metal. And lastly, again, kind of cleaning up your diet, which we're going to talk about here in a second with PCOS, because too much of the eating processed foods and that sort of thing can lead to excess estrogen. And one more thing, soy. Soy is known as a phytoestrogen. So there are some other ones out there, but soy is probably the most common one we'll point to. So reducing or eliminating all soy will also be helpful. So PCOS symptoms. So with PCOS, it's generally caused by insulin resistance. So androgen hormones such as like testosterone, DHEA, are produced in large amounts in men, but not so much in women. And so when it comes to like sugar, sweeteners, and that sort of thing, the processed foods, as I was talking about, what happens with PCOS is they'll end up converting estrogen into testosterone. And so women will start experiencing many different things like the jaw broadening, abnormal hair growth, and that sort of thing. And then, of course, some of the more common signs where it gets its name, the polycystic ovarian syndrome. So polycystic meaning multiple cysts on the ovaries, which can be painful and horrible. So we want to improve insulin sensitivity here, since it has to do with insulin resistance. So one of the best things you can do is exercise. Start with walking, of course, but you want to move towards lifting type exercises, strength training, that sort of thing. I've also found sprinting to be very helpful. And when I mean sprint, it's an all-out sprint, but just kind of listen to your body. Don't pull a muscle or anything like that or fall and hurt yourself. That can be really helpful. And then supplements such as like chromium, berberine can really be helpful with insulin issues. Otherwise, low-carb paleo is what I usually will recommend. So that's the 4th pattern. It's pretty straightforward, pretty simple. Reach out if you have any questions, and I'll see you guys next time.